I feel like it's sort of under-delivered and most people aren't really talking about it anymore.
Some people say that with keto, right? But I went to PubMed right before coming here. There's 6,000 peer-reviewed publications on PubMed, and over the last year, 717 of them. And there's also 558 registered clinical trials on a ketogenic diet on clinicaltrials.gov. I mean, you could look at CAR T therapy as something like this. There's like maybe 400 or 500. I mean, so this is something, there's been an explosion.
Are those spread mostly between cancer, metabolic disease?
Yeah, I actually wrote down, I've been on top of this because I've given there's 40 to 50 clinical trials on psychiatric disorders. So that includes bipolar, schizophrenia, major depression, anxiety disorders, anorexia, alcohol use disorders, alcohol withdrawal, traumatic brain injury, autism.
Anorexia is quite interesting. What do you think? What do you think is the hypothesis there?
Well, anorexia is a psychiatric disorder. It's the psychiatric disorder that kills more people.
Yes, it's the highest mortality.
Yeah. Yep. So, there was a number of studies. Guido Frank, he's at University of San Francisco, I believe. He's an expert in eating disorders, as is my colleague, Dr. Deanna Rancourt, who kind of has a peripheral interest in this. But Dr. Guido Frank is running a study on anorexia. I believe from what I last heard, can't talk about it too much, but I think some of the data is very encouraging. There was case reports that combined a ketogenic diet with ketamine, and that put anorexia into remission. And there's been quite a bit of buzz about that. And for anorexia, typically you steer people away from any kind of dietary restriction.
Exactly. Yeah, that would be traditional thinking.
Yeah, but you have the effects of the ketogenic diet on neuropharmacology, on the hedonic response, on just stabilizing your mood and other factors that could play into anorexia seem to be at play. I was super skeptical because it flies in the face of everything that I know, and we have one of the leading experts at University of South Florida, Deanna Rancourt. I remember talking to her about it, and she, kind of was a little bit skeptical, but the data coming out and looks very promising and compelling. So there's continuing emerging data on psychiatric disorders, largely funded by the Bazuki Group. I think exclusively funded by Jan and David Bazuki, their foundation.